Mobile Crisis, this is Patty.
The call is answered, and within minutes, help is on the way.
This is the Mobile Crisis team in Manchester. We reach out to people who are having psychiatric crises.
It's like 911 for the mind and the soul.
We don't know whether a crisis is coming at 2 p.m. or 2 a.m.
New Hampshire is required to have 3 mobile crisis response teams by the end of 2017. The first opened in Concord in 2016. Nashua is set to go live later this year. Part of the goal is to divert people who need help from emergency room hospitalization. The funding? The result of a $30 million settlement agreement the state of New Hampshire reached in 2013. The state committed to expanding mental health services to include more round-the-clock care and more community housing and work opportunities. The state's DHHS commissioner says they're working on it.
What happens if New Hampshire falls short on that settlement agreement?
You know, we think we're going to get there. We are substantially there today.
This is sort of the crisis unit in action. You were already at this address and you found some things that concerned you.
We were already there earlier, and there are several people there that need assistance.
Counselors go out in pairs, meeting people in homes, coffee shops, under stairwells, assessing their situation and offering resources.
Just trying to make sure you're all right and see if you still need help.
Compassion is certainly a big part of it, and we also want to reduce the burden on hospitals and emergency departments.
The class action lawsuit alleged that a lack of services left mental health patients languishing in institutions like New Hampshire Hospital or Glencliff, and to their detriment, which, according to the lawsuit, is in violation of the Americans with Disabilities Act and the Nursing Home Reform Act.
One of the things we'll be doing is working with the new governor and the legislature in the upcoming budget process to ensure that the mental health centers have the funding that they need in order to attract the workforce that they need.
In the signed agreement, the state admits no wrongdoing, but committed to expand community outreach and have the progress monitored by an expert reviewer twice a year. News 9 obtained the most recent review, which is critical of missed deadlines. A 6-month delay in the opening of the Manchester Mobile Crisis Unit chalked up to a lack of staffing. The January 6th report states this current pace of staff recruitment and capacity development is not sufficient.
One of the things we're trying to do is explore how we can increase our tuition reimbursement programs, whether it's at the community college system or at the university system in New Hampshire, so that we attract, we really entice younger people to come in and work in this field.
Tried, that's all we can do.
Yeah.
Good job, brother.
You got one guy in this morning.
The opioid crisis is adding to the strain. Travis is a peer counselor. He went out on foot trying to track down a man who vanished after agreeing to seek help at Safe Station for heroin addiction.
It's a tough city to be out running around with and dealing with that. Substance abuse disorders can be pretty dicey.
Our agency is really focused on stigma and really bringing awareness to mental health and that it is a community issue.
We're on the 4th floor of the old Hoyt's Furniture Building here in Manchester. Later this spring, this will be the new headquarters for the Manchester Crisis Response Team. It will include several crisis beds for short-term stays, another requirement of that settlement agreement. For News 9 Investigates, I'm Amy Cavino.